Hey guys, welcome back to the Pulling Curls podcast. Today on episode 82, we're talking about what you should know about you. I mean, you should be the expert in you, right? Let's untangle it. Welcome to the Pulling Curls podcast. I'm Hillary, your curly-headed host on the podcast where we untangle everything from pregnancy, parenting, and home routines. I want you to know that there are no right answers for every family, and I find that simplifying my priorities is almost always the answer. It's tangled, just like my hair. Okay guys, before we get started, I'd love it if you'd leave a review. No, seriously, I would. If you're on Apple Podcasts right now, I really don't see any reason why you couldn't just click and leave some words. Some positive words would be nice, and like 5 stars. Please leave a review. Okay, so when I worked in California, we had a physician there who sent all of his patients in with this card that had all of their important information. It was just like a little, almost like a gift note. And he had them printed up and it just said like the basic labs that they had. And that way, no matter where they were, they could go to any hospital and have that basic information with them. And I always thought that that was so smart and giving to his patients. And the other thing was that those women knew what was on that card because they looked at it. And so often we have women coming in that I'm like, do you know your beta strep status? And they're like, no. You know, when we do stuff like that, we are giving a lot of our power to our provider. So today I want to talk about some of the things you should know about yourself, especially with prenatal care, but we're also going to talk about a few other things so that when you go to the hospital, you know, you should go to the hospital where your doctor has privileges, but sometimes you can't. Sometimes you're on vacation and your water breaks. That happened to my friend Jamie. She was in Hawaii, but you would have that information with you no matter where you were. So, side note. You should really go to the hospital where your provider has privileges. That's really the best thing to do. A lot of people are just like, oh, I can deliver wherever, but go to the place where your doctor has privileges or your midwife or whoever. Do you feel prepared for your delivery? In just 3 short hours, you can be prepared for the confident, collaborative delivery you want. You'll know what to expect and how to talk with your healthcare team, and there are no boring lessons in this class. I'll use humor, stories from my 20 years in the delivery room to engage both of you. I love how Alyssa told me that she found herself laughing at things that used to sound scary. Most of all, you guys are going to be on the same page from bump to bassinet. Join the online prenatal class for couples today. You can save 15% with coupon code UNTANGLED. You can find the link in the show notes. Okay, one of the first things you should know about yourself, and everyone should know about this about themselves, you know, no matter if you're having a baby or what, is your blood type. If you don't know it and you're going to, and you're not pregnant or whatever, ask your provider just to order it. It is a super quick, simple test, just so you know. I noticed during COVID when we were hearing that, people with the O blood type were less susceptible. A lot of people were like, I have no idea what my blood type is. We most often blood type the babies in the hospital. So you should know your kids and just know your blood type. I think it's just handy. Also, when you come into the hospital, it's just nice to know, especially if you're positive or negative, because then of course we have RhoGAM. That's something else you should know. RhoGAM is a shot that they give you if you and your baby daddy, your blood types don't match antibody wise. So my husband's A positive, I'm O negative, I have to get RhoGAM. So usually if your partner is positive and you're negative, you have to get RhoGAM. It is so that on your next baby, your body doesn't decide that your baby's an intruder and try and kill it. So that sounds pretty important, right? Anyway, if you've gotten RhoGAM, you know what I'm talking about. If you don't know your partner's blood type, and that happens very frequently, they will probably just give it to you if your blood type is negative. And then when the baby is born, they'll check the baby's blood type. And if it's positive, then they again will give you the RhoGAM shot. It is a shot. It is in your bum. So yeah. Very important though. Even if you're not planning on other children, I would 100% still recommend getting the RhoGAM shot. You just never know what future holds. Second thing we've already kind of talked about, well, kind of third thing after RhoGAM, is your GBS status. So beta strep, I should do a whole podcast on beta strep coming soon. It's something that they swab in your hoo-hoo and your poop hole, your rectum, for this bacteria that's normally found in women's vaginas. A lot of people think it's an STD. Anyway, they found that it can be problematic in babies that have been in the NICU. They just don't have as good of outcomes if the moms tested positive for this normally occurring bacteria. No idea how they decided to check for that, but they did. And if you are positive, then they just give you antibiotics in labor. But if you are done at 36 weeks, so if you're not 36 weeks yet, you wouldn't know what your GBS status is. But if you are 36 weeks and it's gotten back ask your doctor because it's important for you to know. That's something that you would definitely want to know if you were coming in and you ended up at a hospital that wasn't your hospital. That happened to me once. I got in a car crash, and so I was taken to the closest hospital. But know your GBS status because it just makes it so much easier if we know that you're positive or you're negative. If you're in labor, we can quickly start antibiotics, stuff like that. So GBS status, that's something else you should know. And if it's taken, definitely follow up. Put a note in your phone to follow up with that at your next appointment. So if it's taken at 36 weeks, you probably have another appointment the next week later. It should be back by then. It doesn't come back like right away. And it's not something that they would call you for at home. It's just something that they note on your record, but definitely follow up with that. And hopefully if you have a good provider, they're following up with you on these kind of things anyway, especially beta strep. I would say probably half my patients know if it was positive or negative. And a lot of them I think just don't know because it was negative and their doctor doesn't bring it up. Most of them know if they're positive, but some don't. Okay, another thing you should know is your blood pressure in the office, like what your average blood pressure has been in the weeks coming up to this. Just ask. I'm always so frustrated when the tech doesn't tell me at all what the blood pressure is or the temperature. Like, I don't know. I don't tell you every 30 minutes as I'm taking your blood pressure in the hospital, but I tell people frequently, oh, it's normal, it's good, or it's a little high. A lot of times when you come into labor and delivery, your first blood pressure is going to be high because you've hoofed in off the street and, you're tired. My blood pressure in the office was always high initially because usually I was dragging another kid in with me and I was tired and it was stairs and, all the things. So, but you should know what your blood pressure normally runs. That's an important thing for all of us to know. So just ask them when they take your blood pressure. Okay, the other thing is the medications that you're taking and the dosages. Now, it's probably not something that you're going to have on the top of your head, but it would be something that's important to have in your phone. If you're on thyroid medication, if you're on like metformin or glucophage or whatever, just have it in your phone. And if you're not pregnant and you're listening to this is something everybody should know. I take a Zyrtec every day. There you go. This is my only medication. And sometimes I don't take it, but it's what I take every day. So everyone should really know the medications that they're on and the dosages. I would just keep a Google Keep note on your phone so that you can quickly bring it up, when you're in a situation like that, because it's so frustrating when you ask them. And I don't mind when you go grab your phone and look it up, or you have the bottle in your purse. A lot of people have that. But when it's like, oh man, I don't know. It's like a pink pill and, but I don't know, I'm like, come on, let's take a little care of ourselves. That's not up to me to know your medication. So yeah, there you go. Rant. Okay, here's just a few other things to have in mind, because a lot of times when you go in to have a baby, that's your first like medically thing that you've done without parents. Some people it's not. Some people have had surgeries and all these kind of things without their parents, but a lot of people I see coming in who kind of have a glassy-eyed look and are like, I should ask my mom that. And I know that feeling. I knew that like my grandma had cancer, but I wasn't really sure what kind, that kind of thing. Nurse here. Just, sometimes some families just aren't real open about that kind of stuff. So you're going to want to know your major family history, cancer, diabetes, those kind of big things, big problems in your family, high blood pressure, possibly. You're going to want to know those types of things. Cancer, especially like when I went in to do my mammogram, I had to fill out like everyone I knew's like cancer history. I mean, they were going back with like uncles and I was like, I don't know what's up with my uncles or aunts or anyway, but I think it's just a good thing to talk with your parents about in general. And in fact, sometimes some of that stuff, especially way back, was hidden from us, so we wouldn't know. So it's a good thing to have a conversation with your parents. You're going to want to know your vaccine history. That's probably because Tdap has become in vogue lately. That's probably something that your provider is going to talk to you about in the office. It's really important that we try and have a cocoon of safety for the baby. So we encourage parents, mom and dad, to get the Tdap during pregnancy so that because pertussis has become more frequent, we have a cocoon of safety where mom and dad are not getting pertussis. So that protects the baby a little bit more, because the baby can't get the pertussis immunization for a few months. So if baby were to get pertussis, it is really bad. So that's why they recommend having the Tdap. But that's something that you're going to want to know. And if your mom still has your shot records, get them, right? Just get them. I have mine somewhere. I don't know how helpful they are. And honestly, some of them, like the MMR, we actually do titers on you, which means we take your blood and we see if you have antibodies for it while you're pregnant. Because if you were to get, I think it's roseola during pregnancy, it's really problematic. And so we would encourage you to get the MMR after you have your baby if the titers or the things in your blood showing that you have antibodies. COVID is helping all of us learn a little bit more about all this, right? Anyway, if your antibodies aren't there, we'll just encourage you to get it, because we definitely don't want you to have the roseola while you're pregnant. It can be really problematic for the baby. Okay, vaccine history. Okay, any surgeries that you've had and any issues that you've had with anesthesia. So this is talking about you right now. Some of you might have gotten ear tubes or tonsils, when you were little. So definitely just talk with your parents about how that went. If there are any problems with you and anesthesia or pain pills after that, it's just things that maybe your parents know that have never really passed on to you because they really haven't had a reason. But check with them while you're pregnant so that you can know those kind of things. things. And then finally, one of the big questions that we ask is if anyone in your family, mom, dad, aunts, uncles, brothers, sisters, grandparents, have ever had a big problem with general anesthesia. There's a thing called malignant hyperthermia, which is something that you have in your DNA that doesn't react well with the medications that we normally give for anesthesia. It can be extremely problematic, and it is run through families. So if you and someone in your close-ish mom, dad, brother, sister, aunt, uncle network of family have had that, that's something that we're going to want to know ahead of time, because I think they switch what anesthesia they give you. It's just something great for us to know ahead of time. So there you go. Those are the things that I think it's super helpful to know during pregnancy. Again, keeping an app on your phone. Google Keep is awesome for stuff like this because, it travels with you. It will be on your laptop. It will be on your phone. It will be on your next phone, most likely, if you install Google Keep or Evernote or something like that. Just handy to have that going on along with you. So I think a lot of people are like, well, I want to have a say in my care, but then they don't know stuff like this. And by being on top of your things, it just helps the medical staff know that you want to be involved in your care rather than just do whatever to me. So I think it helps you have a more confident birth when you know stuff like this. So that's why I wanted to come up with this podcast today. These are simple things, good things to know in advance. If you are not currently pregnant and are considering it, ask your mom about this family history stuff, because I think it's really important as you go be adulting around the world. And honestly, now that I'm thinking about it, I don't know that my 20-year-old knows a lot of this kind of stuff. So that's something that I should have a conversation with him about. So if you're a mom and your kids are teenage age, talk to them about this kind of stuff too. Thanks so much for joining us today. I hope we helped smooth out a few of the snarls in your life. We drop an episode every Monday, and we always appreciate it when you guys share and review. Until next time, we hope you have a tangle-free day.